Folks, welcome to my YouTube channel. So today we will discuss about the varicella zoster virus. So varicella zoster virus is one of the family member of the herpes viruses which is known to cause the human infection, and it is distributed worldwide. It is one of the double-stranded DNA virus which has the nuclear capsid which is the icosahedral in the shape. It commonly involves or targets the T lymphocytes, epithelial cells, and the ganglion cells. Clinically, it causes two distinct diseases. In a primary infection, it causes the chickenpox, and if the person is immunocompetent, so the virus will acquire the latency and it will goes into the dormant phase. And when the same immunocompetent person becomes an immunocompromised patient, the virus will reactivate and it will manifest as the herpes zoster or the shingles. While in terms of clinical features, when the person is exposed to a chickenpox, so after the incubation period of around 14 days, the virus will present as a prodrome of fever, malaise, pharyngitis, loss of appetite, and followed by the development of a generalized vesicular rash, which occurs within a 24 hours. So the rash of are the rash which are induced by the VZV virus is commonly arises in a central region such as the face, and then it will distribute into the distal or the peripheral areas of the body, and this type of the distribution is also known as the centrifugal type of a distribution, which arises in the central portion and then travels to the peripheral areas of the body. So when the rashes are mostly in the vesicular type of the rashes, it is very important to remember that these are highly contagious and the person can transmit the virus easily to the other patients or the other people. Especially it is very disaster for the people who are immunocompromised. So first discussing about the primary infection or the chickenpox. So once the generalized rash is developed, it is very much significant and it is very unique with the varicella zoster virus, which in these rashes are developed or these rashes progress through a successful crops. It means like first they start as the macules, it means a flat lesion, then they develop into the papule, then they develop into the nodule, and ultimately they gives rise to a vesicular type of the lesions, and the vesicular type of the lesions will then develop into the pustules, and finally they will crust it over. So when the person has the high or the predominantly they have the vesicular type of the rashes, they are also described as the dew drops on the rose petals. So it is very unique for the varicella zoster virus. When you examine the patient, so the rashes will be present in the different stages of the development. The some rashes will present in the macule stage, some rashes will present as a papule stage, some rashes will be present in the vesicular type of the stages. It is very unique only with the VZV virus, and it is very much important to see the different stages of a rashes in the same person, and it is very important to differentiate it from the measles or the other type of rashes which are induced by the different viruses. But and if the person is immunocompetent, so the virus will acquire the latency, but at the same time, if the person is immunocompromised, the person can develop significant complications through the varicella, which includes soft tissue infections, pneumonia, hepatitis, encephalitis. The people who are at the risk of developing these type of a significant complication includes the elderly population, especially the people who are above 60 years, the pregnant woman, and the patients who are immunocompromised, such as patients who are active HIV patients, patients who are undergoing chemotherapy, undergoing radiation therapy, or who are on the corticosteroid or other type of immunosuppressive drugs. So once as we described the second category of a varicella zoster virus is that if the person after the varicella goes away and if the person is immunocompetent, so the virus will acquire the latency period. But when the similar patient goes into the immunocompromised state, the virus will reactivate. Once the virus reactivates, it will manifest as the herpes zoster or the shingles. So clinically, herpes zoster is characterized by the painful unilateral vesicular eruption, which commonly is restricted into the one dermatome, but sometimes it can involve the multiple dermatome at the same time as well. Then it is known as the herpes multiplex, but overall it depends upon how much the person is immunocompromised. Commonly it involves the thoracic dermatome, and another thing to keep in mind is that those type of the rashes never cross the midline. So how the pathogenesis of the virus is developed. So on the right top of this picture, the green line shows that how the virus uh, comes into the human body. So one of the route of this virus is through the skin, and another is the through the aerosolized pathway. So in this picture, the skin is shown here. So once the virus gains entry into the human body, and if the varicella goes away, and then if the varicella goes away, then the varicella virus will travel into the spinal nerves in a retrograde fashion, and then will ultimately goes to the dorsal root of the spinal cord where the sensory ganglion are present. And if the person's overall immune status is healthy, the virus will remain dormant over the period of the time. But if the person become immunocompromised, then it will manifest as the in the form of the herpes zoster or in the form of the shingles. While in the ventral root in the spinal cord represents the motor activity, where the another famous polio virus can affect and the person can have a motor disabilities. While the virus is it is traveling into the sensory ganglion of the spinal cord, the same VZV virus can also uh, travel to the enteric nervous system as well. So, what are the risk factors of developing the herpes zoster? As we described earlier, the elderly population. So, out of all those significant factors, the most significant factor is the age. Age is still the most important risk factor for developing the herpes zoster, and because of this factor, the incidence of the herpes zoster is still increasing. And the other condition, immunocompromised patient and the patients who are undergoing the treatment for the autoimmune diseases. So as we said that the incidence is still going up, and it has been estimated by the CDC that approximately 30% of the persons in the United States will experience herpes zoster during their lifetime because as the life expectancy is increasing, so the chances of developing the herpes zoster is also increasing at the same time. So how the herpes zoster will clinically manifest? So it will clinically manifest as the unilateral, painful, burning sensation types of the vesicular rashes, which commonly involves the one dermatome, or at the same time it can involve the multiple dermatome, but the those rashes never cross the midline. They commonly restrict themselves to the in a one area. So, what are the complications of herpes zoster? So, the most common complication of the herpes zoster is the post-herpetic neuralgia, and other includes ocular, neurological, or the bacterial superinfection of the skin, especially the Staphylococcus aureus, and another is the Ramsay Hunt syndrome. We will discuss this one as well. So, the post-herpetic neuralgia is it is the most common complication of the herpes zoster. It manifests as the significant pain which persists after the 90 days after the onset of the rash. Along with the pain, it has the sensory symptoms which includes numbness of that area, dysesthesias, pruritus, allodynia, which means extremely sensitive to the touch. Say, for example, if a person developed the herpes zoster into the cervical dermatome, and if you ask the patient, can you comb the hair? The person will feel a lot of pain in that area. Another is the Ramsay Hunt syndrome, which is also known as the herpes zoster oticus, which it develop when it develop when the varicella zoster virus acquires the latency into the geniculate ganglia. When the virus acquired latency in that geniculate ganglia, which is the part of the facial nerve. So facial nerve is the one of the cranial nerve which has the motor activity and the sensory activity as well. As the geniculate ganglion is the part of the facial nerve, when the virus reactivates in this ganglia, so the motor as well as the sensory activity of the facial nerve will be lost. So in terms of a motor activity, there will be the paralysis of the facial nerve and the person will drop drop his jaw. And in terms of a taste sensation, there will be loss of taste sensation over the anterior two-third of the tongue. And along with the losing the facial nerve, the person can have a vesicular type of a rashes on the external ears. The person can have a painful eyes, and the person can have develop the vestibular or the auditory type of a sign symptoms as well. So in terms of a diagnosis, so the clinical presentation is more of the time it is sufficient to diagnose the herpes zoster or the varicella, as we discussed that the generalized rash which is developed by the chicken pox is it is present in the different stages of the development, such as again one more time, like macules, papules, vesicles, pustules, or the crusted lesions. And if the clinical diagnosis is still not confirmatory, or it is still it is uncertain, so the laboratory confirmation is indicated, and the most specific and the most sensitive test to diagnose this is the PCR testing. While in terms of the treatment, if the person is immunocompetent and if the person is less than 12 years of the age, there is no treatment indicated. The person the varicella virus will goes away and the person's own immunity will fight back and it will restrict the virus. But if the person is on the risk, say for example the person is unvaccinated, the person is elderly population, the person is pregnant, or the person has any immunocompromised diseases, these type of the people are at the risk, and then the antiviral therapy is indicated. So the most common therapy for the treatment is the acyclovir or its analog, and these are generally most effective treatment. While in terms of the immunization, so in our next video we will discuss about the immunization, the schedule, and the contraindication and the precautions before giving the immunization, and what are the adverse effects of these immunization. The adverse effects are very important to know because it is one of the live attenuated vaccine, so it has some adverse effects. So we will discuss these things in our next video. Till then, thank you so